right, well, we've been talking about wounds, who gets them, and talking about how we should initiate treatment and what the protocols are. Let's get a little more specific. Wound care centers, we've mentioned them in passing. What is a wound care center? And in the best of all possible circumstances, what is the role of a wound care specialist? That's a phrase you've used a lot.
So a wound care center is basically an area, usually in a hospital, because that's the only time that a wound care center can actually be paid for their services.
Wait, can you back up for a second? You
Sure.
can't be a freestanding wound care center?
You cannot. You have to be, in order to be paid under CMS, you have to be affiliated with a hospital.
I'm shocked. I actually am shocked. I would think you could have a freestanding
Managed
wound care
care
center.
allows you some latitude with that.
Does it? How so?
Well, one of the companies that I had founded actually was sort of a company that brought all of the advantages of a wound care center to the outpatient environment. The company was technologically enhanced. We used some nice gee whiz bang type of technology in order to be able to render that care. But to your point, Doc, on a classic Medicare fee-for-service, freestanding outpatient wound care centers are rare. But managed care has the latitude to be able to create them.
Okay, but you can carve them out inside a hospital setting.
You can carve them out
Yes.
inside a hospital setting. Sometimes they're managed by ancillary groups, management groups that will actually manage the clinics for them, the hyperbarics, hire the nursing staff, the physicians, et cetera. But it actually is a place, theoretically, where you have a group of experts practicing under one roof. You have nurses who are extraordinarily familiar with wound management protocols and therapies. People, as with any other specialty, will go to these specialty clinics for specialized care. Now, is that always the case? Unfortunately, it is not.
And if I were to ask you to, in a nutshell, define the role of the wound care specialist, because when I was in medical school, nobody said to me, gee, when I grow up, I want to be a wound care specialist. You laugh, but I'm sure that's happening now. Some people do want to do this. What is the role of a wound care specialist?
Two things I wanted to say. One thing I wanted to say first, there is has to be a metamorphosis. To your point, no one goes to medical school or podiatry school and says, I want to be a wound care specialist. It has to be an evolution.
Okay.
What was the second?
Well, what do you do? How would you define what a wound care specialist actually is and does?
So a wound care specialist, to my mind, is someone who understands the appropriate protocols as they currently stand, who is practicing evidence-based medicine, who understands the importance of education, who understands that the patient has to be the center of the equation, and can work in a multidisciplinary.
I'm simply going to make a statement here for the record. I love podiatrists. I work with them every day. We work with them in the operating room. They are amazing. That's a specialty which requires focus, and what they bring to the table is underappreciated. So thank you, all of you out there, and those of us at the panel too. I mean, it's really amazing. It's great.